If you're pregnant or can become pregnant, here's what you should know about the medical procedures that could save your life, especially if you live in an abortion-banned state. First, let's establish what a miscarriage is. A miscarriage is when a pregnancy has stopped developing before 20 weeks. Symptoms may include bleeding, cramping, and passing pregnancy tissue. Or an ultrasound can show no fetal cardiac activity even if the patient has no miscarriage symptoms. What are the treatment options for patients having a miscarriage? When a patient is having a miscarriage or is at high risk for one, they should be offered 3 choices. The first is expectant management, or waiting to see if the body will pass the pregnancy on its own. The second is medication, like misoprostol or mifepristone with misoprostol, which causes the uterus to contract and can speed up the process. The third option is getting a procedure called a dilation and curettage, or DNC, in the first trimester, or a dilation and evacuation, or DNE, in the second trimester to empty the uterus. If a patient is bleeding heavily or showing signs of infection, doctors recommend a DNC or DNE to protect their health, medical experts say. How have DNCs and DNEs been affected by abortion bans? DNCs and DNEs are used for both abortions and miscarriages, and most state abortion bans aren't clear about when physicians are legally allowed to perform them. This can create confusion and fear around offering the procedures. For example, a patient can be in the process of miscarrying, but there may still be fetal cardiac activity. Some doctors consider intervening to be a legal risk because managing the miscarriage in that situation could be defined as an abortion, and in states with abortion bans, that could come with criminal penalties. In Texas, for example, doctors can face up to 99 years in prison for performing an abortion. How to prepare for emergencies. You can talk to your doctors in advance about what to do if something goes wrong, experts told us. You can ask questions like, if I think I'm miscarrying, can I receive care at your office, or do I need to go to the ER? Do you do DNCs and DNEs? How often and where? If my water breaks in the second trimester, do you offer the option of abortion care, or do you wait until there are signs of infection? Which hospital do you recommend if I need emergency care? What to do if you're experiencing signs of a miscarriage? Cramping and bleeding can be signs of miscarriage, but not always. Call your doctor or midwife to discuss symptoms first. If a doctor says to go to a hospital or a clinic, experts suggest asking for an ultrasound to guide your care, an OBGYN to be involved in your care, info about all 3 treatment options, and the treatment option you prefer to get. Be on the lookout for symptoms like high pulse and feeling faint, which could mean you have a serious complication. Bleeding heavily, such as soaking a pad in 30 minutes or less, is a reason to ask doctors if it's necessary to empty the uterus, experts told us. Head to the link in bio to see what you can do if you think you aren't getting the care you need, and for more info on what to do if you experience pregnancy loss in an abortion-banned state.